COVID-19 appears persistent in its presence with the continuous emergence of new variants. The recently identified subvariant JN.1, which initially caused concern in the United States, has now been detected in the Indian state of Kerala. According to the Union Health Ministry, India observed 237 new coronavirus infections. The active cases in the country have increased to 1185 as per the official data. Additionally, Kerala has recorded 230 new COVID cases in the last 24 hours. In November, Kerala documented 479 cases, and within the initial 8 days of December, an additional 825 new cases were reported. The state accounts for over 90% of the total COVID cases in India. While one patient lost their life in November, two patients lost their life in December. While doctors suggest that the majority of cases are mild, the symptoms are aggravated due to the atmospheric pollution and climate change. Now let's talk about what's happening globally. Initially, the variant called HV.1 surfaced in the United States towards the end of the summer and gradually constituted a larger share of the circulating virus. As per the American Center for Disease Control and Prevention, it surpassed EG.5 to become the predominant variant in late October. However, at that time, scientists across the globe were closely monitoring two other variants, which included JN.1 and BA.2.86, which they asserted carry a concerning number of mutations. JN.1 was first detected in Europe in August 2023, followed by England, Iceland, France and the US. The scientists in the US found the JN.1 variant to be more infectious as it possesses extra immune evading capabilities. Last week, US reported that the JN.1 variant constitutes over 1/5 of all cases, and the surge in prevalence suggests that JN.1 may cause increased spread and enhanced capability to evade individuals' immune systems. Concurrently, according to the American media reports, indicators of COVID-19 spread such as hospitalization and deaths remain elevated, particularly in the Midwest and Mid-Atlantic regions. This trend aligns with the typical increase in respiratory illnesses during winter months when people gather indoors and celebrate holidays. The World Health Organization in Europe in August had warned member countries to maintain their COVID-19 infrastructure and genomic surveillance after noticing a gradual increase in cases, including hospitalizations in some European countries. Recently, Singapore also reported a rise in COVID-19 infections. In the week of November 26 to December 2nd, the estimated number of infections rose to 32,000 compared to 22,000 cases in the previous week. The average daily hospitalizations and ICU admissions have also increased, though the Health Ministry of Singapore said that the numbers are not as high as during the pandemic. The experts in the country have asked people to put on their masks and remain up to date with their vaccinations. No need to panic as of now in India, but it's the holiday season, so it's crucial to be careful. If you are elderly or have any other medical condition, take extra care of yourself. Remember to wear mask, keep your hands clean, and make sure your vaccinations are up to date.